you discussed with Dr. Gunson your own kind of thoughts about surgery, how you've been, it's your biggest fear, you said.
Mhm.
After MSE and the gains that you've gotten from MSE, do you feel like you can live like this? Are you stable for a while? Or now that you've gotten some, do you want more? And are you just imagining what it would be like to have a centimeter of advancement or something like
Right?
that?
You get greedy. You just want more. So it's funny because I turned my MSc, I think it was like 82 turns. And then it wouldn't turn anymore. And Dr. Ting's like, stop, Nicole, you're going to break the MSc. I was like, don't turn anymore. So I actually maxed it out. I think it was a 12 millimeter one. Um, and you kind of want more, right? So I felt like I got really good expansion. I could breathe better. My tongue used to be crammed in the back of my throat. I could see on the CBCT, so those x-ray images, my tongue is up, but it's just pushed back into my throat. When I got expanded, the tongue can actually come up and forward. So although you're getting horizontal or transverse growth, it was a little bit of front back. Like my tongue could come forward also, right? So MSC is not forward sagittal AP growth. It's just widening in this direction. But I did feel like soft tissue wise, I got a little bit of forward growth. So I feel like my jaws want to be forward more because, of course, they do. I had like a retractive treatment as a child. So there was already a problem. And then we just pushed everything back. And I feel like everything should go forward. Dr. Ting is like, just get jaw surgery already. But physically, I don't have chronic headaches anymore. I used to have chronic headache. When I was on the CPAP, it went away. That's Dr. Simmons, the sleep physician, told me just try the CPAP to see if your issues are airway related. And they were, because it went away completely. I would wake up with
Mm.
like stomach aches from reflux, but I didn't know why. But I'd be like, oh man, I have a stomach ache every morning. That completely went away because you get reflux when you have poor breathing at night.
Yeah, why? Can you explain that? Is it because you're swallowing air?
No. Mm-mm. So it's what happens is in a tube. So if you think of your nose down your throat as like your breathing tube, any narrowing in any part of that tube, I don't have it next to me, but I have a straw. I show my patients like a straw. I hold it there. Any narrowing in any part of that tube is going to cause the air to rush faster through the narrow part to get to your lungs. So if you have a deviated septum, or in the nose, you may have enlarged nasal turbinates or congestion, or in the throat, you might have large tonsils or large adenoids at the back of the nose, or a narrow palate is a narrowing in the breathing tube, or a low tongue. If your tongue's low and back, that's narrowing your breathing tube, right? Any narrowing in any part, what happens to the air? It has to flow quicker through that more narrow part. And that quickened flow of air causes negative pressure in the airway. It's called the
Mm.
Bernoulli effect. It's like a
Mm.
physics law of airflow. Well, negative pressure causes the sidewalls of the airway to collapse or suck inwards.
Mm.
Okay. So, what happens there is now that negative pressure actually causes you to suck up stomach acid and gases. So, you are physically sucking up or refluxing into your throat, into this, even the nose. You can wake up, if you go to sleep fine and you wake up with congestion in the morning, that is a telltale sign of obstructed breathing at night.
Mm.
And that actually went away. My son, when he was 8, he got MSC also. We went in together and he no longer wakes up with morning congestion after the MSC. So you can actually, that reflux causes inflammation in the airway of the throat, the back of the nose, and that
Mhm.
causes the airway to get smaller as well because it's inflamed. So it's a sort of vicious cycle. So reflux, when you're sleeping, is oftentimes correlated to poor breathing from a reduced airway size, causing you to create this vacuum of negative pressure, sucking up stomach acid.
Mhm. Mhm. It's basically like putting a plunger on your throat and sucking up
There you go.
stuff that's
Exactly.
supposed to be down.
Exactly.
Oh man, that's another one of these, effects of having a small airway that people would never consider, but it's just so devastating.
Yeah. And sometimes you don't realize you have reflux. And I didn't even know that that's what it was. I'm like, oh, I have this weird stomach ache every morning when I stand up and walk around. It kind of goes away. I don't know why. That went away completely when I was on CPAP and then I stopped and did the MSC. And I rarely get that. But if I'm too flat on my back, some of these symptoms come back. So you ask, like, permanent changes. I feel like I have better breathing, better sleep, less symptoms of like headaches or anxiety during the day, things like that. But the airway is still vulnerable. If I maybe drink a couple too many drinks, if I am too flat on my back, if I eat a heavy meal too close to bed, things like that, it's still susceptible. And I feel like comfort wise, I would love to just have everything brought forward, like Dr.
Mm.
Benson we talked about in that interview. It's just, I don't know.
Would it be with Dr. Gunson?
Oh, I don't know. I haven't even investigated if I would ever really have MMA surgery, but I hear, from so many patients who have that it's life changing. I mean, people are able to get taken off of blood pressure medication like that night. The first night, I've heard this multiple times. That first night of sleep, these patients feel like they've breathed better than they have their entire life because it's all structural, it's anatomical. Sleep disordered breathing is an anatomical illness. Does that make
Mm.
sense?
Yeah, of course. You mean the first night after surgery where they're like coughing up blood and they're still
Yeah,
super
I don't
swollen?
think for coughing up blood. That would probably be bad. But yeah.
Thank you for correcting me on that. See, it just goes to show there's so much negative perception about how miserable and terrible jaw surgery is. And I think it's probably not as bad as we all think.
People even say it's actually not even that painful. So it's, you're swollen and there's a long recovery period, but it's life changing for those people who are really having health related issues, or daytime related issues, or on blood pressure medication, or there's so many health consequences to untreated sleep disorder breathing. And it doesn't have to be apnea, we talked about that. That it's life changing. And so yeah, people say that first night it's almost like you take a airway the size of a cocktail straw and you've
Mhm.
just made it a garden hose. You've
Oh my
moved all the
gosh.
structure. They can breathe again or breathe like
Mhm.
they've never breathed before. It's really interesting. Dr. Bill Hing, are you familiar with him?
I met him in 2014. He was my first orthodontic consult back when I started on all this. Yeah, so I haven't spoken with him in 9 years, but I know him. Yeah.
Yeah, he does a lot of lectures on this and shows different patients who are just like, I first night. I know he lectures on one patient who probably within a few days or a week was able to be taken off of blood pressure medication just from the jaw surgery because it's all related
Wow.
to sleep problems, breathing problems.